Good afternoon and a very warm welcome to you. My name is Jeannie Mabonengdi.
Welcome indeed. I'm Bonnie Boothie. Hope you had an amazing weekend. Did you celebrate Halloween this weekend at all?
Happy Halloween. It's actually today.
It's today. But a lot of people had parties on the weekend.
I know. I went away for the weekend, so I didn't get to dress up as a mouse.
Right. So I went to a Halloween party and I went dressed up as a bunny, a Playboy bunny. And so, yeah, as I arrive, my friend's little 6-year-old son says to me, "Oh, I see Bonnie just came as just a rabbit." So it gave me a lot of perspective.
Well, happy Halloween if you are celebrating. Now, today is going to be quite an interesting show because I'm going under the knife.
I know. How are you feeling, Babs? How
I'm
are you
really,
feeling?
really nervous. We have possibly the best plastic surgeon in the entire country here, and he's putting me in the hot seat for the fountain of eternal youth.
Is that you, sure?
This will not age.
We also have in the lab, Penny Jenkins will be showing us a non-invasive treatment which helps with scarring. So can't wait to hear that.
And in the kitchen is another fountain of youth. Danilo.
I was about to say I was waiting for some kind of snarky comment to come about my youth, but I'm still young and still working it. Welcome to the show, South Africa, and welcome to Afternoon Express. In the kitchen today, Clem Pedro, our resident chef, is here. And not only are we going to show you how to make a delicious recipe, we're going to show you how to make your eggs in the perfect way, which I think is quite interesting. So give us a bit of background here.
So, you know,
it's Monday.
It is Monday. And
we're lazy.
It's the first day of the week, as new beginnings. Exactly. So it kind of is. Monday's the start of the week.
You're birthing the eggs and you're birthing newness into the brand new week, aren't we?
Exactly. And people are like often starting a diet. Like, I know it's silly. I'm starting a diet. I'm starting on Monday, right? People always start a diet on Monday.
Yeah.
So if you're going to think about being healthy, being conscious of what you eat, everybody's on this healthy food vibe.
Sure.
The king of all healthy foods. This little guy right here.
Well, you have to stay tuned to Afternoon Express to find out exactly why that little thing over there is the fountain of youth, according to Clem. That's what his idea is. So we're going to try and treat it with food. They're going to treat it with chemicals on that side a little bit later on, right here on Afternoon Express. We'd love to hear from you on our social accounts, particularly today on Facebook. We're asking you the question, have you or would you ever go for Botox? If yes, why? And if no, why not? I'll be reading your comments live on air. So head over to our Facebook page and go and comment on that post, and I'll read your comments live on air. Speaking of Botox...
I know the time has finally arrived, and if I'm looking a little funny to you, it's because I've actually got numbing cream. I can feel that, but I can't feel... Yeah, no, I'm pretty numb. I'm pretty numb. Now, Dr. Ridwan Mia is a widely celebrated plastic and reconstructive surgeon who famously performed the first cloned skin grafting procedure in Africa on the 3-year-old Isabella Pipi Kruger a few years ago, which you may remember, it was all over the media. And he's not only a doctor, though, he's also a philanthropist and does a lot of work for the Smile Foundation and, of course, the Burns charity, Children of Fire. Welcome.
Thank you so much.
Thank you so much for being here. You're amazing.
Yeah, you've gotten Jeannie very excited today. So in 2013, you were awarded the Order of the Baobab by the President for the work that you did with Pipi. Can you take us through the Pipi case?
Well, essentially, she was 2.5 years old, sustained severe burns in a family braai accident where a fire lighting gel had exploded and flew 3 meters in the air and landed on this poor little girl and burnt 80% of her body surface area and burnt her quite severely. She suffered inhalation injury. She was in the ICU for many, many months and, you know, it took us a long time to get her stable. And eventually we had the dilemma of how to cover her burnt wounds. And we came up with the idea of cloning her skin, which we did at a lab in Boston in the United States, and then had the challenge of flying that skin back to South Africa on time and then graft her, which we eventually did.
Which you pulled off.
I mean, how do you even... Like, what does the skin look like? How you take it? Do you farm it in sheets?
Yeah, farm it is probably a good word. It uses stem cell technology, and it's the ability to replicate a cell line of your body, and we replicated the external cell line, the epithelial cells, and that gave us sheets of cells, very thin, you know, 5 to 8 cell layers thick, and it comes on a special backing, and that's how we transported it. And yes, you have to handle it very carefully. It's very fragile, and it took us a long time to very carefully place it onto her.
I think,
You do a lot of philanthropic work. Why is that important to you? For somebody who, I'm sure, makes plenty. Why is that
Well,
important
I think
to
it's
you?
my family background. We come from a family where they've always preached the mantra that the best among people is he who benefits mankind. It's a saying from the Quran, which my parents always quote to us. And so we've grown up in that mold and always done what we could for our community.
I think if you look at your work that you do with the Smile Foundation and, of course, the Burns charity and what you've done with Pippi, I mean, it's nothing short of a miracle. I think, like, doctors you're born a doctor because it's so special, the work that you do, saving lives. Why and when did you decide that you wanted to become a surgeon?
I used to watch an uncle of mine who was a GP, and he was a real generalist. He did a lot of little surgical procedures, and he was a good teacher as well. So I learned a lot from him, and I got wooed by the profession because it looked like something you could enjoy doing, but at the same time something you'd feel satisfied with.
Yeah. And when most people come to you for surgeries and stuff, what's the main issue that they're always battling with or dealing with? Is it just basically, I want to look like Kim Kardashian or...
Yeah.
I think it's a variety of things. You know, it could be things they're born with, congenital abnormalities. It could be things that have happened because of scarring or injuries. Or, again, it could be an aesthetic concern, something they want to just improve, like the shape of a nose or a scar improved or better lips, something to be better or more than themselves. And we have to give them advice either way on what would work and what wouldn't. It's just a big variety of things that they want changed.
Wow.
Who does need work done? Because I know sometimes, I think especially when it first came out, it was quite controversial because sometimes people go too far. And I suppose that's when you would have to be the judge and say,
A lot of our work as plastic surgeons is psychology. It's chatting and talking to our patients and counseling them about what is essential, what is needed, what isn't. And there's a line that you have to not cross. You know, it's a very ethical boundary, and we have to make sure we keep our patients within that. So nobody's going to look like an animal, or nobody's going to look like a movie star that they've been idolizing all their lives. They're just going to look more like themselves, but improved.
Yeah. Have you ever said no to a surgery?
Very often. Very often.
And
somebody
on what grounds?
Somebody underaged, for example. Somebody seeking a very unreasonable procedure, a strangely shaped nose, something implanted under the skin, wanting to look like an animal, a cat, for example.
Really? Do people genuinely want that?
Some strange requests. We see some very strange. Or someone wanting to look like another person that they know. You know, so we have to do a lot of counselling in that regard.
So what we're going to do today is go into the lighter stuff, I suppose, the Botox and stuff, which I suppose you guys would consider a lot easier than intense surgeries. At what age would you reckon a woman must start using Botox?
Well, we would suggest men and women consider having things like neurotoxins, which paralyze the muscles in the face, to prevent the onset of wrinkles later. About the late 20s, early 30s, most people would do it, and then they'd see the benefits when they hit their late 30s and 40s.
Oh, really? So I'm in my late 20s, obviously. Should we get started with the work?
We can.
Okay. I'm going to move across to the hot seat. Okay. I'm quite nervous about this.
How are you feeling?
I'm feeling...
Yeah, you're still quite talkative.
But I mean, I've got the best in the country, so I'm going to end up looking amazing at the end of this. Okay, so what are we doing? You're going to take away my frown? Because nobody needs to look like this.
We're going to give you some neurotoxin injectable solution into your forehead. That's going to paralyze your muscles and take away those wrinkles that you've got developing.
Sorry, what?
Developing. They're not yet quite developed yet, but it'll prevent them from coming on. And then we're going to give you some filler material into your lips to give you more volume and make them look more younger.
Okay.
Wow.
Make me young again. Let's get started.
So is it going to be painful?
Well, let's get started with the forehead.
It's going to be a little bit painful.
We've used some numbing cream around the lip area to prevent that, but we're going to be injecting the forehead on our own, and we're going to see how that goes.
Okay.
Wow.
Okay.
How long
No pain, no gain. We can start with the forehead. I think we'll do the mouth last because I really don't want to feel anything. Okay.
Need the Botox from the fridge? Can we get some?
Okay, yeah. We need the Botox from the fridge.
Let's get that.
What's Danilo taking the Botox?
What was Danilo doing with my Botox in the kitchen?
So what's actually in Botox?
Essentially, Botox is a trade name. So there are various different other names, like Dysport is another name.
I heard it was
that you'd use.
snake venom.
No. It's actually from a bacteria. It's called Clostridium botulinum.
Yeah.
And it's a toxin that we use to paralyze your muscles. So it's greatly attenuated. It's a lot more powerful in its natural form, and it's greatly attenuated, especially for this purpose.
Okay.
Okay.
When is it too much?
When you have a frozen look.
What do you mean?
So, we don't want you to look like you're overdone.
I mean, just over time, like how much Botox can a person do within reason, like, and still be healthy and still be functional?
Essentially, you want to look like you have enough to paralyze your face so that you don't have... So we're just cleaning the forehead.
There's a lot of makeup on this forehead. Jokes, I wake up like this.
So we're going to begin some injecting.
How are you feeling, Jeannie?
You managing okay? Just about.
Feel young?
So we'll ask you to lift your forehead, lift your eyebrows, and relax. And we'll do that on a continuous basis as we keep injecting.
What? More? Okay.
Okay.
Oh, wow, okay. Danilo, you have something to say?
Oh my goodness gracious me, it's good to be a guy. All right, South Africa. On Facebook, we're asking you the question, would you or would you not Botox? Why or why not? Some very interesting conversations happening online. I'd love to read through some of those comments. First of all, we have Tulisa saying, Ish, I don't think so. I would even consider it. Besides, me and needles, we just don't get along very, very well. Nuran says, I don't think so. Enjoy your body as it is. Why would you want to change it? Shopo says, I definitely would have Botox because I must age gracefully. Pretty sure there should be like a darling after that one. Bube says, no, God created you like that unless you have had a very bad accident. Kurt says, maybe, and if it will make me look younger, then why not? And Antoinette Nordia is saying, yes, of course, it's an amazing method of prevention. Well, it's really exciting to see some of the gents also commenting on this stuff. I'd be very interested to know how many guys out there would be interested in doing some kind of Botox treatment to look after their skin in the future. More from our doctor after the break as Jeannie gets this turned into this.
Welcome back to Afternoon Express. You're live on SABC3. Now, in case you've just joined us today in the loft, we're joined by a renowned plastic and reconstructive surgeon, Dr. Ridwan Mia, and you're just in time to see the last bit of Jeannie's Botox treatment. How are you feeling? Oh my gosh, it looks so painful.
It wasn't actually that painful. I just have no pain threshold whatsoever.
Like
this, I'm really scared for.
Okay.
I mean, I don't think this chair
hold your hand.
is hard enough for me. You're going to be sore. I'm going to squeeze.
Squeeze.
So what we're going to do is give you some filler in your lips. And, okay, are you ready?
No.
Okay, so here we go. I'm going to be in your upper lip, just injecting some volume. You're going to feel very numb in a couple of seconds. Here we go. Very well. You're doing a great job. There you go.
Well done.
Okay.
It's done.
How long does it last?
It should last 4 to 6 months. And some people even longer.
4 to 6 months.
Okay, I'm in the border of your lips. There we go.
Don't look amazing yet.
I would say
You have a sense of humor.
really amazing. You'll see your lips plumping out. quite
Okay.
nicely.
We're going to let them finish, and Jeannie, you can squeeze my hand as hard as you need to. Moving along now, for many of us, the idea of introducing bold colours into our wardrobe can be a little intimidating, but it doesn't need to be if we have the right advice. In today's Trenery Style Workshop, we find out from fashion doyenne Jackie Berger how to stylishly incorporate the perfect shade of red into your everyday ensembles.
The idea of wearing colour can be a little bit daunting. I'm going to show you how to do colour in a chic and understated way. This dress comes in the perfect shade of red and the stretch makes it comfortable and easy to wear. Keep the palette fresh by accessorising it with white espadrilles. If you find bold colours challenging, try grounding the outfit with muted shades and understated prints. Pair a dusty red chino with a crisp white shirt. Contrast the clean look by adding a striped jacket. This graphic navy sandal picks up on the stripes of the jacket. A navy sling bag worn crossbody completes the look.
Kind of feel bad for not wearing anything red today at all. All right, on Facebook, we're asking you the question if you would do Botox or not, and what your reasons were behind either saying yes or no. And some really cool discussions happening. Some of the comments that I wanted to read out. One from Alexandra Smith, who says, I have Botox every 3 months. However, mine is not for cosmetic purposes. I have a condition called dystonia, and it causes my neck muscles to pull stiff. The Botox helps tremendously. Pamela says, sorry, but I will never stiffen my face and look all swelled up with multiple injections. I will just die. And I'm gifted with not looking my age. I would rather eat good and exercise. Sanelia also says, yes, if it were to happen that I became a victim of a circumstance, but all in all, people should do something they feel comfortable with. It's your own skin after all. And Anita says, I'd only, or rather let me say my cellulite, it's too much, so I wouldn't mind reducing it. I go to the gym though, and squatting definitely does help. So lots of different tips and tricks there. Continue to share your advice with us, whether you would go do Botox and what your reasons were for saying yes or saying no. After the break on Afternoon Express, we're going to go check out what Jeannie looks like at the moment. You're basically done. How does it feel?
Well, so far it's actually really
You're such a brave woman. Well done.
Thank you.
Well done.
Like, it wasn't for somebody who's got a really, really low pain threshold.
Yeah.
Like, at first, the first jab, you feel something, like you feel the prick, and then it's actually okay. I mean, I don't know what I look like. I'm going to have a good look, but my lips are totally numb. And, yeah, how long will everything last?
4 to 6 months.
Okay.
Sometimes longer.
Yeah.
But I think the fillers can last up to 9 months.
Oh, really?
Is there anything in diet that can aggravate it or lessen its effects?
No, not really. This is fairly superficial. It's all in the skin. It makes no difference what you eat.
And what about post-prick?
Well, be careful of the sun. Don't do anything that's going to make you sweat excessively, so no gymming or anything like that for the next 3 days.
Oh, no. What?
Move your forehead a lot so you get the toxin to spread around.
I must move my forehead a lot.
Move your forehead a lot, and not too much movement around the lips.
Oh, well, no kissing for me.
What is a vitamin treatment?
Well, it
is
varies.
it a drip?
It's a drip, yeah. It's a vitamin drip that you can get to replenish all your vitamins that you should normally be getting from your diet.
Wow, okay, it's that simple. I thought it was quite an involved...
It's fairly basic,
treatment.
Just a supplemental treatment that you can have.
Okay.
The bonus is it's a full bolus into your bloodstream at the same time.
Okay, all right. Thank you so much, Doctor.
Thank you.
After the break, we'll look at some non-invasive scarring treatment. We'll be right back after this. Welcome back to Afternoon Express on SABC. Jeannie's with us and she's alive and well.
Yeah.
Yeah, looking amazing.
Thankfully.
Already, Bats.
Thanks, babe.
When it comes to skin rejuvenation, anti-aging, there are also many non-invasive treatments to try. And even if you do get Botox, some of these treatments could complement the Botox treatment. Joining us now is manager of LaserMed in Cape Town, Penny Jenkinson. Welcome to the Loft, Penny. Welcome back.
Welcome back to the show.
Was that fun?
Sure. It actually does spike your adrenaline. I mean, I feel like I'm psyched. I can go and run on the promenade now.
Yeah, I can't. I could never. They'd have to put me under, like, to do that stuff to me.
No, it's not so bad. But I have to ask you, after all of that I've just been through, are there peels and things that you can do that also reduce the look of lines and scars and veins and whatever else?
So now with Botox, what we've done is reduced expression lines. When we do lasers or peels, we're going to treat resting lines. So Botox works for expression lines, but you still need to address your resting lines, and you still want to stimulate your collagen production to delay further aging. Wow. So peels and laser will definitely complement your Botox. You wouldn't go and do it on the same day, but most definitely for long-term anti-aging and to give you a healthy, rejuvenated glow, other treatments are definitely worthwhile investing in.
Look, at this stage, I really don't mind aging. But what treatments are we going to do today for us?
All right, so today we're going to do a superficial to medium depth TCA peel. Now, obviously, the deeper the problem, the deeper we need to work. So although our patient doesn't necessarily have scarring, we're going to address adult acne, pigmentation, and a few acne scars.
Okay.
If a patient came to us with deep acne scars, a superficial peel or a medium depth peel is not going to be effective.
Okay.
We would use a laser, for instance, a CO2 fractional laser that penetrates much deeper because the damage is deeper in the skin.
Okay.
But now pigmentation is hormonal. Like I know a lot of women that either from using the pill or when they fall pregnant or after having a baby develop a lot of pigmentation. Should a girl start a pigmentation treatment even when she doesn't have any?
Well, you can start non-invasive superficial peels to delay the aging process,
Okay.
but sunblock is vital to prevent pigmentation, to prevent sun damage.
Yeah.
And if someone is on the contraceptive pill, their skin is more light sensitive, so you have to use sun protection.
Right.
But I mean, you can't express this enough, and I hope everyone at home is listening. You have to. You live in South Africa. You have to use sunblock every single day.
Absolutely.
And 2 to 3 times a day, actually. So if you've been in the water, the minute you get out, you reapply your sunblock.
Is it true that the factor on sunblock, I know I'm changing the subject now, but the factor on sunblock, is that the amount of time that it works for?
Correct.
So if it's factor 30, it means you've got to reapply every 30 minutes if you're in the sun.
Normally 2.5 hours. So if it's a factor 15, it's every 1.5 hours you would reapply.
Okay.
But in clinical studies, they always use thick layers of sunblock. And in reality, we put on as little as possible, so the efficacy is not the same. So the minute you've out of the water or you've perspired, you reapply your sun protection.
So this treatment can be used to reduce scarring or remove it completely?
Okay, scarring we can never remove. Regardless of what laser we use or how intense the treatment is, we can only improve a scar. Okay? Scarring is a damaged cell or damaged tissue. We cannot repair that and make it completely smooth.
Now, I recently got a scar on my leg because I went go-kart racing and
Thanks,
I was racing.
Maps.
I was
Hashtag
racing
thanks,
with
Maps.
Maps Mapanyane, and Maps crashed into me.
The naughty boy.
And his go-kart landed on my shin. And I now have the scar. I've had this now for 2 months.
All right. So
What would I do with this?
Okay, so
Besides killing Maps, but what do I do?
What is more prominent there is the darkening of the skin, okay? And that's called post-inflammatory hyperpigmentation. So because of the trauma, your skin has gone dark. And the best treatment there would be to use a laser called a Q-switched Nd:YAG that's going to shatter the melanin of that inflammation. It takes time. You probably need up to about 3 treatments, and even a lightening cream would also help. So my first choice would be to do the laser, and then we could look at peels to improve the scar tissue.
Scar tissue.
But we need to improve the colour firstly.
Okay.
And what's very important, when you scar, different areas of the body heal better than others. So as you've just seen, the legs don't heal well at all.
Yeah, and shins are just so temperamental in general.
So we also have to treat it very carefully. If I treat you too aggressively, I will actually make the condition worse.
Worse. Okay, I'm coming to you for the laser, and I'm sending Maps the bill. So
Should we get started on our peel?
Yeah.
All right. Okay, excuse
I
me.
want to see the miracle in action.
All right, so what I've done is I've marked the model's face because we're going to divide it into areas. And I'm simply going to apply the peel with, with earbuds. So every peel has a different technique.
Sure.
And some are time dependent, some are layer dependent. So we're going to do a peel that's layer dependent. And we're just going to do half the face and then I'll carry on later. So I'm going to apply in circular movements. Now, the patient shouldn't feel too much discomfort initially, but as we apply more and more, she will start to feel tingling.
Yeah. Like a burny tingle or like a cute
Just
tingle?
uncomfortable.
Okay.
All right, just lift up your head.
And is that the first layer of skin coming off? How many layers of skin
it depends
come off?
how deep I go. So
Okay.
what I'm looking for is frosting. The more frosting I get, the deeper I'm going. And if there's scarring, I want to be deeper to get a better result. So if I just did a superficial treatment, we're not going to see anything happening.
What do you mean by frosting? What is a...
I will show you
is
just
the
now.
face
So
going
it
to
goes
frost?
cloudy. We see white
wow.
little speckles on the face. If I was treating a darker skin, I don't want the clouding, but just pinpoints of frosting. So with Nicole, we want to actually see some frosting occurring.
So after this treatment, what is she going to look like? I mean, are the
Very
effects going to be
old.
seen very immediately or over a couple of days?
All right, so what's going to happen tomorrow, she's going to look like a prune and start to wrinkle, all right? She's not going to look attractive. She's going to look like she's 70 years old. And then on day 3, 4, and 5, she's physically going to peel. So layers of skin are going to come off.
She's going to shed like a snake?
Yes.
So you basically can't leave the house for the next 3 days, babe?
You can if you don't worry, if you're not concerned. And then
You're not leaving the house for the next
Do not leave the house.
And then by Monday, that peeling process should have taken place. Now, actually, we can start to see here on this little pimple, and even here, there's frosting occurring. So that, for me, is wonderful. But I'm now going to put more on because I want a better result. So we're going to start all over again.
What other types of scarring is there? You mentioned earlier on when we were talking about razor bumps.
Yes. So people who suffer from ingrown hairs can also develop scarring, okay? And the best way to treat ingrown hairs is to use a laser, an Alexandrite laser or an ND-YAG laser, because that's destroying the root of the hair. By waxing or shaving, you're actually aggravating it. And what happens is often someone will develop a keloid scar, which will grow.
Just because of an ingrown hair?
Yes.
Wow.
And to remove that, you would have a surgical excision and then even radiation. But unfortunately, the results are not fantastic. It's not going to prevent further scarring. So the idea is to actually treat the cause before you have that scarring developing.
So now our beautiful model, after having this, surely her brand new skin after she shed is going to be really sensitive. So then what treatment is there? Like obviously a lot of sunblock.
Moisturizer and sun protection. Now if you look, if you can zoom in, you'll see how this area has frosted already. So that is 10 out of 10. I don't need to go any deeper there. That's perfect.
Stunning.
We're starting to see frosting on the chin, but I still need to get more frosting on the side of the face.
Amazing. And let's hear from our model. What does it feel like?
How are you feeling?
It tingles and very warm.
Okay.
And the minute I put the post-peel cream on, that discomfort's going to disappear. And ideally, Nicole needs to have a treatment again next week. We're going to do 4 in a row, 1 per week.
Oh,
so this is an intense treatment, all right? It's not the norm for everybody, but it's one of the options.
Nicole, you have to send us selfies, before and after selfies.
I'll do that.
With hashtag no filter.
All right, let's do 1 more layer.
And can one repeatedly do this over, I don't know, like how long? Every 6 months or?
Well, it depends on the skin. So once Nicole's skin is under control, she could do superficial treatments to maintain that. But obviously, she also needs to use sunblock and good home care.
Wow. Amazing. Thank you so much.
It's a pleasure.
Nicole, we're going to let you have your peel in peace. Danilo, let's cross over to you.
Yeah, but yeah, speaking of all things beautiful skin, we have obviously been running this really cool competition on Afternoon Express, asking you and your BFF to send through photographs of how you guys are getting ready for summer together. And we've got some of our entrants that I had to show you, as well as I get to announce our grand winner, which is cool for this week. One of our first entrants came from Tanya Lomax. Thanks for your message. There was over here, it's a photograph of her and her daughter. She says, I have dark pigmentation on my cheeks, probably from all the years I never listened to my mom when she told me not to spend so much time in the sun, with a really cool photo in there. I'll zoom in that so you guys can have a look at it. Really cool. Thank you so much for submitting your one. Another one of our entrants was Lami Kandlovu, who says, keep it even. Me and my BFF drink a lot of water this summer, and the daily use of Dettol even skin tone removes all the excess oil and reduces blemishes on our skin. It is nice and soft and glowing. We're not ashamed to rock them on the beach this summer, all thanks to Dettol and this even skin tone that they've got there, with a really cool photo of her and her bestie. And then our winning post for this week, drumroll please, is Tumelo Mokwena. Congratulations. You win yourself your really cool hamper with the selfie stick, a really cool smartphone, and some really cool Dettol goodies. The post reads, nothing is as exciting as getting ready for summer because it is the only time to show off the beauty of your skin, and that means taking care of our skin. Essential ways is drinking correct amounts of water to keep the skin hydrated and clearing my skin with Dettol Even Tone Hygiene Soap. Dettol Even Tone, keep it even with Dettol Even Tone Soap. My skin feels fresh, smooth, radiant, and rejuvenated, giving me the confidence of a healthy feeling. Hashtag Dettol Even Tone. Hashtag Keep It Even. Hashtag Skintastic. I'm not going to go through all of those hashtags. You guys can go and find them on our Facebook page. So thanks so much for all of our entrants. And if you did manage to enter our competition, here's how.
Welcome back to Afternoon Express. Today is all about beauty, peels and Botox. And we're going to have a look and see how our gorgeous model is doing with your peel. How is it? Is it all done?
It's done.
Yeah, I finished the treatment. It's quick, it's easy, there's no downtime. She doesn't need to take time off work, but she will peel in a few days' time. Okay. And within a week, her acne will have improved by 80%, and the texture and the quality of the skin will also have improved.
Amazing. Awesome. Looking forward to seeing your selfies that you're going to send us. Right now, though, we've got a caller on the line, Linda from Gauteng.
Hello.
Hi, how are you?
I'm very good, and yourself?
Good, thanks. Welcome to Afternoon Express. What's your question or comment?
Okay, I have 3 questions. I don't know if you're going to be able to answer all those 3 questions for me. But then the first question is, with Botox, what could possibly go wrong? Any side effects with Botox? And then the second question is, I have a very oily skin, and I've tried so many face washes, but it seems that it's not working.
Okay, thank you.
What can go wrong with Botox?
Yeah.
Something I should have asked before the treatment.
With any neurotoxin, there's always a chance of giving too much in a specific area. So you may see somebody who's perhaps had too much injected. We often find this with people who've had injections done by perhaps people who haven't trained or qualified properly in that area of medicine, and you'll find somebody with an eyebrow that's perhaps more paralyzed than the other side, or some asymmetry. Allergy to the actual Botox is extremely rare. There have been no reported cases in South Africa and ever, so it's very rare in the world. But that could be another possibility.
What would happen to somebody who was allergic to Botox?
They would have a rash. They would have perhaps breathing difficulty. The same as an allergy to any other drug. You know, they would manifest with swelling in that particular area as well. Wow. But it was very rare. And the good thing about it is, if you've had too much in a specific area and it does cause asymmetry, it will wear off in a little while. And also you can have some more injected into the other side if it's not too severe, and you can make them the same.
Awesome.
Penny, can you answer the oily skin question, perhaps?
Oral medication can be given by a dermatologist to control oil, or chemical peels will also help to balance the oil production. But often it's a combination of the treatment and oral medication that's required if it's excessive oiliness.
Right, right. Besides just aesthetic, what are the medical conditions that Botox can be used for?
So we use the botulinum toxin for things like cerebral palsy, particularly children who have joints that are too stiff to open up. So the muscles are so tight that you have to release them using the toxin. That was the initial use from a medicinal point of view. We also use it in people who have hyperhidrosis, so people who sweat a lot, under the arms or in the palms of the hands, where the hands get so wet they can barely shake someone's hand or touch a piece of paper and make it get wet, so without letting it get wet. So we inject it for that purpose as well. And pain, migraine is something you can use it to paralyze some of the muscles around the head so that they don't have such severe headaches.
Amazing. Thank you so much, Doctor. Right now, though, let's see what Daniela's up to in the kitchen.
Well, I know it's only Monday and everybody's pretty excited for the rest of the week and everyone's on that sort of countdown towards the weekend. But Clem, I've managed to find out exactly what we're doing on the show today. Is the only thing that I've ever worked out that hates Friday.
Eggs.
Eggs hate Friday. Do you see? Do you see Friday? You were expecting like an excellent joke, but it wasn't. It was just Friday.
Cracking good one, Dan. Well done.
What a cracker. So yes, South Africa, Clem and myself are going to be making something in the kitchen, so that's very simple to make. It's not even a recipe, so I just want you guys to learn more about free range. And we've learned a lot about this over the process of Afternoon Express, and I'm really trying to educate myself on the idea of free range. So please tell us what we need to know. So
every time we cook with eggs, you always hear me saying free range eggs or nothing else.
Okay.
So the thing is, and it's a great thing for me, is that Woolies is the only major retailer to stock and sell only whole free-range eggs.
Okay.
Which is really great. And did you know that they source over 120 million eggs a year?
Jeez, I don't know how many chickens that is, but anyway, beside the point. Explain to me what exactly free range means, because I don't think I fully understand what free range means.
Okay, so they've got this, Woolies have an amazing, very strict guideline to all the suppliers about what to them is free range, and it boils down to the fact that the eggs are not only responsibly sourced, but ethically sourced, which is very important. If you're going to be eating food, you're going to be cooking with food, go for the greater option. It's the most important thing. You have to eat with tomorrow in mind.
Yeah, but that doesn't still answer the question what free range means. It means that they're ethically and responsibly sourced.
So it's their diet, and they eat the chickens, the hens, not Woolies people. The hens themselves eat a strict vegetarian diet, so they're not being giving any other byproduct of any other food.
Hormones and things.
No, the hormones, so it's the vegetarian diet, and they're actually free to roam during the day with unlimited shelter and water, which is quite important.
Right. Okay,
which
cool.
I mean, along those lines, that's basically what the free-range egg is. So the chickens are actually acting like chickens, going out and behaving like chickens as they should, which results in a much better quality egg. Which is very important. And for those strict guidelines, in 2014, Woolies received the International Good Egg Award for those practices, which they maintain every year since then.
So when it comes to sticking to standards, they really aren't clucking about.
Not at all.
Absolutely doing the right stuff.
It's a well-laid executed plan.
And it
has to be followed.
Okay. So what are we going to do today with these eggs? Because I mean, I've always tried to boil like eggs in the shell, and I can never get it right in terms of the temperatures. And people have told me to add vinegar to the water, add salt to the water. What are the things we should and shouldn't do?
And it's not just you. I mean, we get so many viewer requests to explain the degrees of cooking an egg, not even a steak, how to cook eggs, boiled eggs, and later on scrambled eggs, which is quite amazing. That's what people want to know.
You see, so we do listen to what you guys say on our social accounts. Okay, cool. So I'm just passing this to you.
Absolutely. I reply to them, don't you?
Boom. I check them. I reply, obviously.
Okay. Now, Dan, I've been joking. Today is not about the free-range egg, actually.
Oh.
You know, the egg is a sign of new beginnings, and I saw on social media this new hairstyle. So to go with the new hairstyle, I just had to do an egg dish with new beginnings. So clearly, Dan, this is all for you and your new hairstyle.
This is so rude. I actually can't even deal
it's
with you right now.
It's beautiful, though, Dan. It's amazing.
I can't actually deal. You're so rude. Get over yourselves.
I want the country to see your brand new hairstyle. It's so, can you guys let us know on social media what do you think about Dan's new hairstyle? Why are you blushing?
Because it's super awkward. It was like I needed to go for something new. I was tired of the upstyle, and I keep it nice and simple. It's sort of I've seen it on the high streets of London fashion, so I thought I'd try it out and see if it works here. Now you're making me blush.
Cool. I like it. I like it.
Cool.
Thanks.
Thank you very much.
So, as you spoke about, so many people have different methods of boiling an egg. They go from cold water, then they boil it up. Some people add salt, some people add vinegar. The best and easiest way is to bring your pot up to a rapid boil. That way you can actually shock the egg once it gets in there and seals the proteins on the outside. That's the egg white. And all you do is you get a slaughter spoon or a normal spoon, and don't chuck it in. It's not going to work.
Yeah.
No.
And
Gently
at the
just
bottom.
drop it slowly into the water.
What is the reason for not adding salt? Because I understood salt helps the water to boil more rapidly and quicker. It helps it boil faster because it's got a what do you call it, a lower boiling temperature.
It highes the boiling temperature, yes. So
Highes
it actually boils at a hotter temperature, but you don't need that.
Okay.
Eggs are delicate. They don't need to be cooking at massive high heats. That's enough to cook the egg perfectly.
Okay. And one thing that I've always done wrong, which I've been told was done wrong, is that I always try and take my eggs straight from the fridge and put them in the boiling water. And sometimes then the shock can actually crack the outside of the shell. So keep your eggs at room temperature.
Room temperature, they store beautifully in the fridge.
Yes.
But take them out a little bit before you bake with them, or before you cook boil eggs.
them. Okay,
exactly.
cool.
So we've put our eggs in. Now let's talk about how long we're going to cook them for. So over here we've got an egg that's boiled for 10 minutes.
Okay, so slightly more yellow than usual, okay?
And that's our hard-boiled egg.
10 minutes is such a long time to boil an egg.
It is. That's your hard-boiled egg. And then this is your 8-minute egg, which is a medium boil. And then this is your 6-minute egg, which is quite soft.
Okay.
And this is how I like it. But just, I like a little bit, maybe, I actually like a, let's just say a 7-minute egg.
Okay,
where
like
my
a
proteins are
6
more
and a half.
sealed.
Okay, cool.
But it's still nice and runny, so you cut into it.
Oh, and that just happens. That is
happens.
the best feeling in the world. Almost looks like you've poached that egg in somewhere. I'm really surprised that you managed to get the shell off that egg. How do you do it? Do you like tap it on the table?
No, my trick is to, after they come out the water for the exact amount of time, straight under ice water or straight into ice water. That way it stops the cooking process. And you tap the top and you tap the bottom. Crack the tops off, crack the bottoms, and then you just start peeling straight away, and it comes right off. No funny shells breaking off or proteins breaking off. That's the easiest way to do it.
Amazing. I also know that eggs in themselves are probably the cheapest way to consume protein, I've been told. So that's like a really nice thing to know, that if you are still in the markets today, you want to go and buy your whey proteins, you want to go and eat lentils, do whatever you want to do, the cheapest way to consume the right amounts of protein are through buying eggs itself. So it is still a cheaper method to do that. And I know we're not only just boiling eggs on the show. You're like, what the heck, Afternoon Express, you're just going to make me boil eggs on the show today? No. After the break on the show, we're going to be making the perfect scrambled eggs. Clem's got a whole bunch of tricks up his sleeve. What I'm going to say is there's some delicious ingredients thrown into this mixture. So don't you miss that.
I actually think that's a very good idea that Clem came up with. What do you think of Danilo's hairdo? Let us know on social media. In the meantime, though, we asked you, would you consider Botox fillers and would you consider getting work done? Faisal Davids Lawrence says, yes, I would definitely have Botox or a little work done. Then Matthew Reese Hansbein says, I would totally get some filler here and there if I needed it. Then Selani Grace Tebe says, most definitely if there's room for improvement, then why not? Then let's go down to Nomali, said, only our Jeannie D will be brave enough to do it on national TV. Brave enough or mad enough, darling? Thank you so much for all of your comments. We're reading all of them out, or as many as we can, on our Facebook page. Otherwise, tweet us at Afternoon Chat using our hashtag Afternoon Express. We'll be right back.
Welcome back to Afternoon Express. So we're in the kitchen using those free-range eggs, and we promised we wouldn't just boil an egg on the show today. So Clem is going to be showing us how to make the perfect scrambled egg. But I think it's important to do a lot of research about eggs because they are important things. And I wanted to ask you, how many eggs do you think you can eat on an empty stomach?
On an empty stomach? Oh, how many can you consume?
Yeah, it's
I feel like
scientifically.
there's a joke at the end of this, though.
Maybe.
Okay, tell me, go.
Take a guess. So take a guess.
4?
Okay,
5?
no, 1. Because the minute you eat 1, your stomach's no longer empty, so it's not an empty stomach anymore to eat any more eggs. So just 1 will do just fine. And speaking about, I don't know, scrambling up jokes, let's make some scrambled egg.
Let's get started. Cool, so I get my pan on. And all I'm going to start off with is, actually, I'm going to get you to do the scrambling. How's that?
Great, that's my favorite part.
There we go. You got your bowl, got your whisk. So can you, I've got 4 eggs for you. Can you go ahead and start?
Cool. One thing I've wanted to ask you always, you can carry on doing what you want to do.
Absolutely.
But I was always very interested to know like about the egg and the milk ratio when it comes to scrambled eggs versus omelets, or the sort of, some people put water in the omelet mixture, and then how many eggs per person? It's one of the things that irritates me the most. I'm a guy, everyone always says like 3 eggs per, 3 eggs per person. Is that enough? I always find it too small.
Well, that's the thing. You can totally bulk it up. That's not a problem at all. But I think anything less than that, you're going to have quite a little scrambled eggs. I think 3 is a good number.
3 is a good number. So we're going to go with 4, just to show you what a good-sized portion will look like.
As your preference. I mean, whatever you prefer as well. Cool. I mean, we spoke about the fact that how good they are for you. It's got all those good fats in there and proteins. Yeah. It really is a superfood.
Cool. And you are making me sort of whisk these eggs up before you've added any sort of milks or like salt and pepper or anything else in there. Is that how it's meant to be done?
Yeah, no salt and pepper going in. I'm sorry, no, yes, lots of salt and pepper, but no milk's going to be going in there today.
Okay.
No milk at all. I actually get my creaminess from the butter that I use. Okay. And I use about a tablespoon of butter. I know it sounds like a lot, but it really, really does the trick. So you keep on doing that. How about you add some salt and pepper for me?
At the same time?
Yeah, absolutely. I love quite peppery scrambled eggs.
Then I'll keep them quite peppery for you. And this is one of the things that I've always tried to understand is how much of each do you go. I think I'm just going to put the way I know how.
Well, you can always season afterwards as well.
Yeah.
So are you ready for me?
Cool, ready for you.
So here we go. So our butter's nice and frothy, and it's slightly begun to turn. And that means you're going to get a little bit of nutty flavour in there as well.
Cool. And are there any tricks of the trade when it comes to making sure that your scramble comes out perfectly, it doesn't stick to the bottom?
Yeah. Use a non-stick pan. It works every time. Don't worry about using anything else because it's going to always end up being a mess, okay? Cool. So you can see my sides just start to gently set. So I'm going to just pull it towards the center and let the unset egg a bit fill its place. Yeah. And I'm going to continue doing that. And that way you start building layers of eggs. That's what you want. You want the layers and the cream.
You always want it foldy and flappy. That's kind of the opposite of what we're talking about Botox today. So, basically.
What do you think? Looking good so far?
Looks so yum.
And that butter adds a lot of richness to the eggs as well.
Wow, okay.
Which you actually want. Eggs, I mean, they're quite amazing. So now, okay, now I've got most of it set.
Cool.
So I'm just going to do a little
flick
flip.
it over, just to break it up, break those little bits up. This is so fascinating because I've always thought that you must just try and keep it moving as much as you can to prevent it from like...
Nah, you're going to risk burning the eggs that way. Sure, so now, what I've done is the eggs are 90% cooked, and I've taken it off the heat.
I'm going to laugh at you because it looks like a failed omelette is what it looks like.
It looks like you're trying to make an omelette. Nice and fluffy. And then the eggs are 90% cooked. You can take it off because there's enough heat in there to actually cook it a lot further.
Cool.
So that's fine. So Dan, I'm just going to pop this down here. Actually, you can give me a hand. Quickly, quick. Really dropped it there. Just put the toast down for me.
Cool, a few slices of toast for us. How many guests do we have? About that many. That looks about good.
Ow! Did I burn you?
Almost.
Almost.
Filled the heat.
I'm just going to start putting the eggs down.
Delish. Oh, you want me to lay it down like that? Yummy.
Oh, well, you know what? It was supposed to be on top of the toast, but we're just going to end up doing it like this.
Cool. And then you want to add your own little spice to the stuff by, I guess, adding your own little bits of fish in there.
Yeah, I'm going to go with this amazing sashimi grey trout.
Delicious. Okay, delicious.
All right, so just keep it nice and simple.
Just like that, and you have breakfast in the morning. It sounds like one of those dishes you can have at any point during the day. Sounds amazing. Congratulations. Thank you. Delicious. Excellent. We managed to finish this over. Let's take this to the table. Yummy. We're having breakfast for dinner, guys. Hope you don't mind.
Yeah, I love eggs. It's my best.
And I also heard that adding the trout in there, it's got lots of omegas in it. It's great for your skin.
Good.
Yeah.
See, I eat.
So what did inspire the new haircut?
To be honest, it was like I just was tired of having to do up my hair every morning. So I thought, like, why not save time and save money?
Well, it looks magic.
Thank you.
Thank you.
Thank you, everybody.
New hairdo, new face. I mean, what a way to start a week.
Thank you so much, all of our guests, for joining us in the loft. You taught us so much. South Africa is cringing on social about all those injections, but we really learned a lot today. You guys, South Africa, have a good night and have a happy eating session, I guess.
Bye.
Would you like some?
Coming up tomorrow on Afternoon Express, we meet Bongani Boloy, South Africa's youngest mayor, and media entrepreneur Thibaut Touch gets us up to date with his latest business ventures.
Another feel-good production.